Okay, I guess we can just start this over.
Okay.
Okay. Hi, everyone. This is our interprofessional team seminar video. Together, we're going to share a little bit about what we came up together on how we explored and defined radical belonging and how we applied it to the case presented to us about Mountain View Healthcare. So we're each going to talk a little bit about what we all came up with together and do a little bit of reflection.
Okay, so first we wanted to talk about what we think radical belonging means. And through reading the case and the articles that we were given, I came up with, so radical belonging is a truer sense of belonging for historically marginalized individuals that might be achieved by decentering whiteness in a system, whether that's education, politics, a healthcare system, what have you. Instead of striving for individual people of color to feel like they belong in or accepted by an oppressive system, we should instead create a new system that includes marginalized groups at the center as a priority. In general, just upheaval of a long established system to include and benefit everyone. And so just to reflect on how what we learned from this experience, I think that we accomplished a lot as far as like making the project and like talking about the cases together. And so we can accomplish a lot when there's a mutual trust and sense of responsibility for the cause, whether that's doing an assignment or caring for a patient.
Next. So to summarize what we learned from the case and why belonging in healthcare teams is important, we learned that radical belonging is only achieved through collective efforts and a shared understanding of its meaning. It's not just an individual concept. Radical belonging encompasses social, academic, and democratic belonging. Social belonging encompasses like an ethos of care, respect, and appreciation for people as they are. Academic belonging means envisioning learning that is agentic, responsive, collaborative, and anti-hierarchical. And democratic belonging engages students, families, and educators in collaboratively developing shared understandings of and resistance to white supremacy and interlocking systems of oppression. Everyone's ideas and perspectives need to be treated equally. And then the importance of why belonging in healthcare teams is important is because it boosts team morale. Everyone's ideas are equally important and deserve discussion. Therefore, people are more willing to participate, and then it also encourages cohesiveness within the team. And then just in a reflection on working with the team on the cases, teamwork requires everyone to be on the same page, so communication is key. And then we want to exercise patience when listening to other people's perspectives about a case and respond thoughtfully.
And to continue to just build off of what we've been talking about, creating an atmosphere of radical belonging really has potential to create ripples of change, especially at Mountain Health Fairview. We kind of came up with a proposal together that by enacting small but tangible solutions at the level of the individual, we can create a fabric of solidarity that will unify all the parts of the healthcare team, which currently feel like everyone kind of doesn't feel like they're part of under one inclusive organization. And so Mountain Health Fairview, I believe we really talked about having this zero tolerance policy for acts of racism and discrimination, things like microaggressions, homophobic slurs, or political or social political acts of hate. This is really not a place for any of these in the healthcare system where we're trying to really just help other people. And so we want to just create a platform or a voice for these marginalized or minority identifying healthcare members like Kadra, Jesse, or Jonas, to really share the perspectives and stories about any kind of repercussions. Because if we really are to have people devoted to what they do and to go in every day being the best healthcare providers that they can be, then it's really important that everyone feels like this is a safe space for them to work and come and really give their all every day. Some of the members like Kadra, Sarah, and Andres in specific, they really cited feelings of burnout and feeling overworked due to things like staffing shortages, inter-team conflicts, and time away from family. We do have time off for employees, and it's really important for members of the team to take this time off I know there's like a hard time during the COVID pandemic with all these employee shortages, but if we don't address its burnout, it's just going to lead to more employees leaving the healthcare system, and it's going to put more strain on the existing workers over at Mount Health Fairview. Many of the members, they have really cited how the deep connections they build with patients, like in the case of Jesse and Jonas, it's really been what's been holding them through the pandemic and really protecting them against burnout. But it doesn't really feel like, or they feel like deep patient relationships are encouraged. But we believe that this should be something that all members should really like take a hold of, especially because some of the members like Kadra and Jesse, they really talk about having that personal connection with a healthcare professional who touched their lives in some way in the past, really motivate them to pursue the health profession to get to where they are today. These small acts of connection can really make a world of difference to the individual, both on the healthcare side and as well for the patients. And just creating an atmosphere of inclusion and connection. Having debriefing sessions to talk about their shared feelings of burnout, to know that they're not alone in what they're going through, having enthusiasm and really addressing issues regularly among the team. This will really help deburden the leaders who are also feeling really lost in this time, especially Andrea and Kadra, and really allow them to really get on the same page as all the members of the team. And just to reflect a little bit on what we've been talking about, like what other reflections really said, just having that sense of communication is so important to fixing and addressing issues. And to really enact change, you have to do so from the top, bottom, and the bottom up. And having both like big overarching changes, but also smaller changes will together hopefully make the change that we need to see.
So as we all know that COVID has had quite the impact on a multitude of people, including the healthcare workers who've been put under immense pressure from the pandemic, which also led to several types of shortages, such as workers, supplies, and it led to an increase in stress for everyone that was involved, which also resulted in exhaustion and burnout, as other team members have discussed. But as a healthcare professional, it is our job to provide care to all. Regardless of any of the marginalization factors, we're to step up during these times when we're needed the most to provide the best possible care that we can for any and for all patients. And with that, the intervention idea is to look at people as people and treat them as such, and to do so to our best ability to aid in improving their quality of life. There's no room for separation or marginalization when it comes to pandemics. So we have to come together and support each other more than ever in order to be able to get through this. We can't do it alone. We have to be able to stand together. So with that, the reflection that I really took from this was leaning on other healthcare professionals and getting their input on something, because it's something that I haven't seen. I haven't been in that realm or that study. So it's really nice to be able to get their point of view and change my mindset as well.
So some key implementation steps to combating the impact of COVID-19 on marginalized populations include going out into the community and assessing the needs of the community through a windshield survey. This is typically done by a public health nurse. The nurse will then assess needs like public transportation, food pantries, clinic needs, and so on. In the instance of COVID-19, a key step of primary prevention would be to provide vaccinations to members of the community and a means to access them, whether offering transportation via a free shuttle or hosting clinics in easily accessible locations like a public school or a church. Information should also be made available through pamphlets in a clinic or QR codes that can be scanned. This information should be easily digestible and informative. Social workers should be made available on a case-by-case situation for families who have been impacted by COVID, whether by death or serious disability or even job loss. For staff members who fall into these marginalized groups, mental health screenings should be made available. All members of the interprofessional team should be called to action. From the public health nurse to physicians, social workers, and so on, we all play an important role in providing care to these marginalized groups. Short term, we're looking at these steps of primary prevention, like vaccination to prevent further casualties and the spread of correct information. Working together as an interprofessional team will aid in our long-term goal of supporting these communities by decreasing their mortality rates of COVID-19, instilling their trust in healthcare, and improving their quality of life. And that was my reflection that I took away from this project.
All right, and to piggyback off of that, to discuss how will we measure our success and the impact that we have and the certain metrics that pertain to that. First, we want to highlight that the integrity of our interventions play into how effective they are at inciting the changes that we have discussed and how that works cohesively as a team and how we can implement that. Our focus, as we said before, is at the individual level and focuses more on things that are tangible to help us achieve our goals. And we discussed that measuring to measure effectiveness of the different policies. First, we'll discuss the zero tolerance policy and how that pertains to acts of racism and or discrimination. We will have our employees, different caregivers and administrative staff alike complete feedback surveys on their thoughts on the effectiveness of the zero tolerance policy, because like that's the people that this will impact and determines how they work together as a team. And to address the measuring success on the leave of absence and preventing burnout, we will track employees that do take advantage of this, and if they feel comfortable sharing why they are taking advantage of the leave of absence policy, that will be helpful feedback for us to determine the effectiveness of that and making sure that it is being used correctly. And also getting employees' feedback on that policy as well through a survey or whatever metric will be used also to determine if they think that is effective in improving their performance in the clinic. Also, as we talked about before, supporting patient rapport is very important to provide high-level quality of care. We plan to track patient satisfaction and how that affects lengths of stays in certain facilities. And this will help us determine if our changes that we are making on sort of that ground individual level are helping to create the environment that we are trying to create. And then next, to move on to the next slide, just to kind of tie it all together, how is our idea sustainable and scalable to other healthcare settings? We discussed with this, we really wanted to highlight our focus on the individual level of these implementations that are being made and how that really affects the relationships between administrative staff and caregivers and then patients as well. It is important to continue to build up on things that we can affect and create a cohesive environment that does incorporate those concepts of radical belonging. And then again, that strengthens those deeper relationships between healthcare providers and patients and gears our system towards preventing those instances of burnout and promoting the ideas of radical belonging. And in reflection, something that I enjoyed learning during this process this semester, working through cases and working on this project, was finding different ways that we can help people just besides the care that we're providing and how that looks on different levels of care.
Thank you everyone for listening to our presentation. I think we all learned a lot from doing this and really like getting to know both the project and each other. And I hope that you all gained a little bit of something about some of these changes that we could do too. So thank you.